we would follow as much as we could the policy of social distancing. We would follow good hand hygiene. We would protect ourselves and protect others. And I would counsel other people to do the same.
But it must make a difference.
Actually has also
but it must make a difference to be living and working in a country where the government takes it seriously, as opposed to a country like the US, where some of your friends, former colleagues, Dr. Anthony Fauci and others, are having to work under a president who, until a few weeks ago, was calling this a hoax.
Yeah, I think Dr. Fauci, Dr. Birx, Dr. Redfield, and I've actually worked for all of them, really are a good team. They know what they're doing. They're competent. They're directed. They will start issuing the kind of clear messaging that you need. I mean, as a country, you have to be decisive. Messages have to be clear. And there has to be an integrated response. And, the United States actually was considered by many to be better prepared for this than many countries. They're a little bit behind the eight ball now, but I think that with the right team in place, that they'll catch up.
Dr. Jerome Kim, thank you for joining me on Upfront. Here in the United States, there have been more than 100 deaths, with the number of confirmed cases over 10,000. With the stock market in free fall, the Trump administration is finally taking the coronavirus seriously. But while major cities like New York and San Francisco are shutting down, experts are warning that the country's healthcare system is about to be overwhelmed. Joining me now to discuss the U.S. government's handling of this crisis is Mike Leavitt, a former Republican governor of Utah, who also served as the U.S. Secretary of Health and Human Services under President George W. Bush. Mike Leavitt, thanks for joining me on Upfront. Let's talk testing. My previous guest on the show out of Seoul was telling me about how South Korea pulled off so many tests, more than 5,000 per million people. Here in the US, you have about 100 tests per million. By the end of February, the South Koreans were testing 10,000 people a day, while in the first week of March, the US had only tested about 1,500 people total. That's a scandal, isn't it? How can anyone explain that? How do you, as someone who's worked at the highest levels of government, when you see stats like that, how do you explain or justify that to people?
When the after-action report is written on this episode, it's clear to me that a couple of things will have been learned. The first is that they need to open up to tests that have been validated in other countries.
Yes.
The second is that they need to spend some time and effort well in advance of this emergency to develop a means by which those can be aggregated. I think a third thing that should be acknowledged is that the nature of the American demographic, meaning it's just spread out. There's 330 million people. It's a substantially bigger challenge, but it's going to be very clear that this will be seen as a weakness. I think that it is being overcome within the course of time, but it's cost us time, and I think there's no question that it has weakened our response.
When you took over as the U.S. Secretary of Health and Human Services in 2005, you talked about how, quote, woefully underprepared the U.S. was for a major disease outbreak. You then drafted a plan, I believe, over the following year to deal with a potential flu pandemic. This time round, though, there was no real planning done because this current Republican president got rid of the U.S. government's global pandemic response team in 2018. He's tried to cut the budget for the Center for Disease Control and Prevention, the CDC. Surely those were incredibly reckless, irresponsible things to do. If you had still been in the cabinet at that time, I'm guessing you would have been advising against it.
Well, the pandemic plan that I was deeply involved in leading was about a 3-year project, and candidly, it remains the underpinning of our national response plan. It was used in the Obama administration in dealing with the H1N1
yes.
flu vaccine, and that was considered to be a success. The same plan exists now, and many of this and all of the same resources are there. I think that we may have on the testing part. I don't think we're going to find that as having been well executed. But
getting rid of the global pandemic response team in the National Security Council just 2 years ago.
Well, there's some dispute about actually what happened, and I'm not here to defend that one way or the other. What I do know is that the United States now is responding in a very robust way with the closing of businesses, with the closing of schools and universities, with a complete suspension of many of our sports leagues and no meetings. that's a quite remarkable response that I think we'll look back on and say there was a lot of American willingness to do so. Now, there will be parts of it that'll be criticized, and that's always the case.
You're right to say it's been remarkable. Just seeing it happen in front of our eyes, definitely remarkable. You mentioned sports leagues, businesses. But on the other hand, of course, you also have beaches in Florida full at the weekend. You have bars and clubs filled to the brim over the weekend in New York, in Chicago, in Boston. A lot of people still not taking this seriously, still not listening to the guidelines. And therefore, should there be more draconian measures taken? Because a lot of Americans just won't do it on their own.
My guess is that could happen in many cities to the degree that this isn't happening voluntarily, and to the degree that we begin to see the large, sharp spikes in a number of cases. I think we'll likely see additional measures taken to assure that there's compliance.
You've also famously said in the past that, quote, anything said in advance of a pandemic seems alarmist. After a pandemic begins, anything one has said or done is inadequate. The problem now, Mike Levitt, is not just that many people believe the response to be totally inadequate, but that the president himself was the opposite of alarmist in the run-up to this crisis. In January, Trump was saying we have it very well under control and it's a very little problem. He said in February it'll miraculously go away by April. He again said he had it very much under control, and also claimed that the Democrats were using it as a hoax to make him look bad. How many American lives do you think have been unnecessarily lost because this president wasted more than 6 weeks downplaying and dismissing the threat from this virus?
Well, given what we know now, those statements are impossible to defend. However, I do think that what's important is what's happening now and in the next 4 weeks, not what happened before. What happened. We now have to, as a people, rally to assure that we, in fact, respond. Now, as you pointed out, there have been about 100 deaths, and that's regrettable. 0 is what we would hope for, but that's not likely to be what will occur. And so we in the United States, like people all over the world, have got to respond. There are good examples around the world, and there are bad examples around the world, and we need to emulate the good ones and avoid the bad ones.
You mentioned, there's been 100 cases and you wish it was 0. Trump said less than a month ago, you have 15 people, and the 15 within a couple of days is going to be close to 0. That's a pretty good job we've done. Of course, we now have close to 10,000 cases and more than 100 dead. You say it's, we should look forward, and I understand that point, but the importance of looking back is the only way you can move forward is if you can take the people with you. And a poll out this week shows only 40% of Republicans, 40% of people who vote for your party, see the coronavirus today, this week, as a real threat compared to 76% of Democrats. Isn't that because of what's happened over the past few weeks? Doesn't there need to be some acknowledgement by the president that he got it wrong? And now he's saying, I always knew it was a pandemic. I'm giving myself a 10. But the reality is there are people in this country who don't think it's a threat precisely because the president told them for 6 weeks it wasn't a threat.
Well, I can only speak for myself. I am a Republican, and I take this very seriously. And I think increasingly, as people become aware of what a serious circumstance this is, pandemics are a part of biologic history. They're part of the history of human history, and they reshape the economics. They reshape the sociology and the economics. So we're now moving into a new phase in this fight. And that's what it is. It's a battle between people and microbes, and we have to be aggressive in our fight. And I think it's clear that we're going to be seeing every American resource directed at this.
You say, you mentioned you're a Republican governor, a Republican cabinet secretary. As a Republican who took this stuff seriously, as a Republican who right now in this interview clearly takes this stuff seriously, do you regret the behavior of your party in recent weeks?
What I celebrate is that we are taking it seriously. I've been through many large-scale emergencies. I've been through terrorist events. I've been through major weather events. I've been through earthquakes. I've been through a lot of different types of crises. And what I've learned is that there's always a time when after the fact you can go back and say, what should we have done differently? But there is virtually no value today in looking back. We have to look forward, and we have to, as a country, build on the strength of the American will, which has been demonstrated by the fact that I'm working at home, and most people who will hear this from the United States will be working at home and staying at home. There's been a unified response. If you could have said 3 months ago, could you see Republicans and Democrats working together to create a set of legislation that would pass in a week? They would have thought that impossible.
No, I understand that. And I appreciate that point. That's a valid point. But when you talk about people staying at home, you're 100% right. People are staying at home. But yet days ago, not weeks ago, not months ago, days ago, the governor of Oklahoma, Republican, California Republican Devin Nunes was saying, go out, go to the restaurants, go out. That's not history. That's happening right now. And people like yourself, shouldn't you be able to say, you know what, that's wrong. I know they're members of my party, but it's not helping the public health effort.
Well, may I say, I don't think this is broken down strictly along partisan lines, and I'm clearly an example of that. And there are many others, many governors who have been saying from the very early on, we've got to act. And it makes really serves no practical purpose for that to occur today. We'll have an election in 6 months. I'm sure that'll be part of the discussion. But today, we need to talk about what we're doing to prepare and how it is we're going to, in fact, as a culture and as a society and as a world, this is not something that any one country suffers on its own. It's one that we're in together.
If President Trump were to ring you up today and ask you for one piece of advice, something he's not doing that he should be doing, what would you say? What advice would you give him?
I would just say you're following a well-grounded plan now. There is a pandemic plan, and follow the lead of the scientists who have experience with this. It doesn't mean that ultimately those who have been elected don't have to make the decisions. They do. But following the advice of public health officials who've studied this for years and who are grounding their decisions based in data and facts is the important thing. The United States has some treasures. Tony Fauci is a person I worked with for a long time. We're seeing a lot of him. It's because he's a seasoned, thoughtful, scientifically based leader who I think is doing a great job.
There have been reports that President Trump tried to offer a German company large sums of money to get exclusive access to a vaccine for the coronavirus, only for use in the United States. Unsurprisingly, the Germans weren't happy. The German government are on record saying this vaccine's for the whole world, not for individual countries. Trying to buy vaccines only for your own country, to hell with the rest of the world, that's the behavior of a sociopath, is it not?
Well, I don't have any evidence that, first of all, that it's true, and second of all, I know enough about having played this out a number of times about the economics and the sociology and the politics of vaccines on a global basis to know that when we get to the point of having a vaccine, there'll be a lot of these discussions, and it won't just involve the United States or any one leader. And as I say, I have no evidence that any of that is true to begin with.
OK, and we've seen a growing list of celebrities, from the actor Tom Hanks to basketball stars from multiple NBA teams, that they've tested positive for COVID-19 in recent days. They got tested quickly and promptly. And many ordinary Americans look at that, especially healthcare workers, and they're saying, well, we're unable to get tested. Is that another reminder that in the US, especially when it comes to healthcare, there does seem to be one rule for the rich and powerful, one rule for everyone else? Mayor Bill de Blasio of New York came out this week and said it's not right that, rich sports stars are getting tested and, poorer nurses or healthcare workers are not. What's your feeling on all of that? Well,
first, COVID-19 is no respecter of persons. And I feel confident that there is no society that is not, in fact, or is, in fact, devoid of the sociology that comes with power and fame. And it's just human nature, I suspect. It's not fair, but it's just human nature. And hopefully we'll get to the point that everyone can have it, and that equality will be the rule.
You're a conservative, obviously, a former senior official in the Republican Party, a party that's long advocated for small government, for a smaller state. What do you say to those who point out that no one's a conservative or a libertarian in a pandemic? Everyone's a kind of a socialist. I mean, everyone, including Donald Trump, your friend Senator Mitt Romney of Utah, wants the government right now to step in and save the day, to spend trillions of dollars to bail out the economy and the American people.
One thing I believe we can say with certainty and confidence, and that is there is a role for everyone in this kind of an emergency. I have said repeatedly that anyone who views the federal government as being able to ride to their rescue will be sadly and tragically disappointed, not because there's a lack of will or because there's a lack of wallet, but because even the federal government doesn't have the capacity to be everywhere. The only assets they have actually are those at the state and local level. And so either any way you look at this, we're going to have a need for every family to have a pandemic plan, for every business to have a plan, for every church, for every university and college, every city and county. That's the nature of why this is so complicated and so potentially disruptive. So listen, the politics are what they are, but COVID-19 and viruses don't have politics. They attack, and their job is to find the most hosts they can inside of the bodies of human beings and animals. And we have to, as a people, as a world, we have to fight back.
Mike Levitt, thank you so much for joining me on Upfront. And that's our show. Upfront will be back next week.
Business Latest is brought to you by Nebraska Power. Business Latest is brought to you by Nebraska Power.
When you see big groups of people walking through Europe, they're all individuals with children and with lives. You have to hear all of them and to treat them with some dignity and respect.
"10,000 deaths globally from the coronavirus. The WHO warns a significant number of those needing hospital care are under the age of 50.
I have a message for young people. You're not invincible. This virus could put you in hospital for weeks or even kill you.
Hello there, I'm Halima Yadin, and this is Al Jazeera live from London. Also coming up, Britain's government orders cafes, bars and restaurants to close as it toughens its response to COVID-19. And as the US state of California rolls out major restrictions on its 40 million residents, non-essential workers in New York are ordered to stay home. Well, the coronavirus pandemic has hit another grim milestone as the number of deaths attributed to the disease worldwide passes 10,000, and just over 4,000 of those are in Italy, where the record number for the number of deaths in a single day has been broken yet again. Soldiers are now being deployed in the hard-hit Lombardy region to enforce restrictions. In the US, the governor of New York State says 100% of all non-essential workers must stay at home. That came a day after the announcement of a lockdown in California. While in Britain, 65,000 retired doctors and nurses have been asked to return to work as the Prime Minister doubled down on national restrictions, ordering bars, restaurants and gyms to close in just a matter of hours. And in stark warning to younger people, the head of the World Health Organization revealed that people under 50 make up a significant number of those needing hospital care. Paul Brennan brings us more now on the situation across Europe.
Across Europe, coronavirus lockdowns have largely emptied the streets to reduce the chances of person-to-person infection. In Paris, residents face a $150 fine if caught outside without good reason. Exercise is permitted, even encouraged, but new restrictions have been imposed along the River Seine and around the Eiffel Tower.
We are at the start of this crisis, as I have reminded the French people in the beginning of this week. We put in place measures to absorb this first wave. It's a race against the virus.
Despite nearly 2 weeks in lockdown, Italy has seen the numbers dead and infected hitting record new highs. People are only allowed out for work, medical reasons or emergencies, and those allowances are expected to be made even tighter this weekend. This is just a snapshot of life in central London, but compared to the lockdowns in France and Italy, the difference is striking. Shops are still open, people are still walking around, driving around. Each and every contact, an opportunity for the virus to spread.
I have a message for young people. You're not invincible. Even if you don't get sick, the choices you make about where you go could be the difference between life and death for someone else.
Until now, restrictions in the UK have been advisory rather than compulsory. But an order for schools to shut finally has come into effect, and the gates will not reopen on Monday. At his latest daily coronavirus briefing, the Prime Minister's guidance to leisure venues became a closure order.
We are collectively telling cafes, pubs, bars and restaurants to close tonight as soon as they reasonably can, and not to open tomorrow.
Newly published documents hint at the struggle ahead. The UK government's latest scientific advice makes sobering reading. SAGE has warned the government that a combination of case isolation, household isolation and social distancing of vulnerable groups is very unlikely to prevent critical care facilities being overwhelmed. Adding general social distancing and school closures to the mix would probably work if kept in place for a long period. How long? The government has been warned that to be effective, a policy of alternating between more and less strict measures would need to be in place for at least most of a year. Around the world, governments are enacting emergency powers, imposing draconian restrictions and confining whole populations in their homes. And there is no imminent exit strategy. Paul Brennan, Al Jazeera.
Well, here in the UK, the Prime Minister has, of course, announced new measures to combat the virus. We'll get more on that from Niamh Barker, who joins us in the studio. But first of all, Niamh, let's start with Italy. The death toll has soared once again, another record-breaking statistic. And now the parks are shut. They really are throwing everything at this, aren't they?
Yeah, they are ramping up their measures. The parks have been closed in the last hour. That announcement came. The message, time and time again, for the Italians, coming from the Chinese specialists who are advising them, is basically you need to shut down your entire economy if you're going to really dampen down the death toll. It's now soared to 627 in a single day. That's the largest jump in any country since the start of the coronavirus outbreak. When Wuhan was at the peak of its crisis, the death toll there was around 150. It's been around 450 a day for the past few days in Italy. Hospitals in the Lombardy region in the north are completely overwhelmed. We know that troops are on the street there to try and enforce a lockdown. Very briefly, a tale of two regions, really. In Venezia, where the city Venice is based, they were very quick to lock down the region, very quick to test people, even people who are asymptomatic. Things seem significantly more under control there than in Lombardy, where the authorities were slower to respond. Of course, the financial capital, Milan, is based there. No sign of the situation becoming much easier for the authorities, for the health workers who are working round the clock in overwhelmed facilities.
Well, the lesson appears to be lock it down and lock it down fast. But here in the UK, no sign of a lockdown at all. But the Prime Minister has announced more restrictions on daily life, has he not?
Yeah, that's right. I think a lot of people here in the UK are quite surprised by how quickly
these new measures have been added almost on a daily basis, incrementally. We were told only last week that the peak of the virus would possibly be in 13 or 14 weeks. It's now very much on people's doorsteps. And as a sign of how critical things are now in London, where things are comparatively worse compared to the rest of the country, one hospital in northwest London, in Harrow, reported that its intensive care unit is now overwhelmed with coronavirus patients. Staff were warned there last night that they run out of critical space for any new patients. That's, of course, on top of the normal demand. So people with road accidents, heart attacks, so on and so forth. Where are these people going to go for their help? The National Health Service here in the UK have been told to find 30,000 new beds as fast as possible. We know a similar situation to that in Italy and Germany and France is on its way. And the message is clear: be prepared.
Be prepared, and certainly keen to lock it down as well. We have heard restrictions relating to bars, restaurants, nightclubs, but also some financial measures too.
Yeah, that's right. Announced by Boris Johnson a short while ago. In the past, they'd only been advisory recommendations, but now an order from the British government to shut down bars, restaurants, cafes, places where people gather in public, basically, to try and bring the situation under control. Those places will be closed from this evening. The government saying that they will review the situation on a month-by-month basis.
OK, well, we'll have to wait and see how that plays out. Many people wondering why it wasn't done sooner, but there we are. Thank you very much indeed. Niamh Barker bringing us all the very latest for us. Now, for a second day, no new domestic infections have been reported in China, in a rare bit of good news. Life has begun to return to normal in some areas, but there are still concerns about cases coming in from overseas. Now, the Chinese government has announced a raft of measures to try and bolster its economy, which is expected to shrink for the first time in 4 decades. Now, the number of new coronavirus cases continues to drop in South Korea as well, but officials there aren't taking any risks at the border. Tests on new arrivals have intensified. It's also coordinating with China and Japan to try and limit the threat of imported cases. Wayne Hay has this report.
Diplomatic tensions have been put aside for now as South Korea, China and Japan pledge greater cooperation to fight coronavirus. Boxes of protective equipment donated by the Chinese government arrived in South Korea to be sent to vulnerable communities. On Friday, the foreign ministers from the 3 countries spoke via video link.
I'm sure we all agree that we need to think about ways to prevent the spread of the coronavirus, as well as the need to minimize the economic and social impacts caused by the decrease of exchanges between our people due to this incident.
Just weeks ago, South Korea had the highest number of coronavirus cases outside China. Now the situation appears to be stabilizing, and the number of new cases being recorded is trending downwards. But there is no sense of complacency in South Korea. In fact, the government is introducing stricter border controls.
As of midnight on March 22nd, we will conduct testing for all people entering South Korea from European countries, and especially for a long-term stay. People will be required to self-isolate or should be sent to an isolation facility for 14 days.
Quarantine measures and border closures announced by governments around the world have meant passenger air travel has slumped at an unprecedented rate. New Zealand's national carrier warning it may need to cut a third of its staff, and the government giving it a $515 million loan to stay in the air.
We do have a responsibility, obviously, to move people around the country, and we take that very seriously, as we do with any repatriation efforts, working through with the government and obviously cargo.
The International Air Travel Association says airlines will need as much as $200 billion in financial aid from governments in the coming months. Wayne Hay, Al Jazeera.
Now, the US and Mexico have agreed to restrict non-essential travel across their shared border to contain the spread of the coronavirus. It follows a similar agreement between the US and Canada, which comes into effect later on Friday. All recreational and tourist travel will be banned, but people will be able to cross for work, and the flow of goods won't be affected. President Donald Trump says he will also invoke a health-focused law to block migrants from from coming in. Live now to Mike Hanna. He joins us from Washington, D.C. And Mike, just talk us through the main measures there announced by President Trump. It seems there are implications, really, on both north and south borders.
Well, indeed, yes. President Trump was at pains to emphasize that this move had been taken in consultation with the leaders of both Canada and Mexico. It's a massive undertaking. The Canadian-US border, for example, is one of the longest in the world. Now, essentially what this does is blocks the crossing to the border to all traffic. US citizens are allowed to cross. Trade and commerce will continue. But very importantly, and this was stressed throughout the news conference at which these measures were announced, undocumented migrants will not in any way be allowed to cross. So essentially, this is as well in addition to what is very clearly outlined as a health measure. It also fulfills what President Trump has been trying to do since he became president, and that is block, in particular, that southern border with Mexico. Specific reference was made to this by the acting Homeland Secretary, who made very clear that undocumented people would not be able to cross, and that this was a welcome measure in terms of the wider policy of the Trump administration, as well as being an absolute essential in terms of combating the virus.
And Mike, we've seen lockdowns being imposed in 2 large US population centres, but not nationally.
Indeed, yes. Well, this has been undertaken by state governors rather than the federal leadership in the center. California, that's the US's most populous state, some 40 million people. The governor there has instructed a total lockdown in effect. People have to remain in their homes apart from going out to get emergency supplies or medical supplies. This is not a recommendation as it has been in the past. This is an order issued by the state governor. Similarly, in New York State, another of the states hit very badly by the virus, there the governor has also issued the same order that people must remain in their homes, only to leave for medical reasons, to go shopping, or indeed to take short periods of recreation. Once again, this is an order. It is not a recommendation. But this just emphasizes how the Trump administration is dealing with this. Essentially, it was stated as well during the Trump news conference that the way you're looking at it is at a county level, measures are taken, then at a state level, measures are taken, and there is a support from the central federal level, the Trump administration itself, to all these parties. So it is, in effect, a bottom-up type scenario. You have got counties even, as well as major states, making decisions for themselves, which the Trump administration then guarantees the central federal government will back up. So that is the way this is playing out. Much of what is happening to combat the virus is coming from the bottom up rather than from the top down, which has its own set of problems. Testing remains a crisis. The delivery of essential supplies remains a crisis. And that is something that the states say they cannot handle by themselves. They need federal intervention, and they need it quickly.
OK, Mike Hanna bringing us all the very latest from the United States. Thank you very much indeed. Lots more still to come here on Al Jazeera, including China and South Korea are turning the tide on the coronavirus, but they're taking no chances. And in other news, the hanging of 4 men found guilty in a notorious rape case is welcomed in India.
On Counting the Cost, can Italy cope with the coronavirus pandemic without a bailout? 14 million auto workers in Europe have been told to stay at home. We talk to BMW about the future of the industry. Plus, airlines fight for their survival as governments impose travel bans. Counting the Cost on Al Jazeera.
There's a wave of sentiment around the world where people actually want accountability from the people who are running their countries, and I think often people's voices are not heard because they're just not part of the mainstream news narrative. Obviously, we cover the big stories and we report on the big events that are going on, but we also tell the stories of people who generally don't have a voice. I remember when I was a child, my dad said, never be afraid to put your hand up and ask a question. And I think that's what Al Jazeera really does. We ask the questions to people who should be accountable, and also we get people to give their view of what's going on.
Threats from biological and chemical agents are real. weaponized throughout history.
Biological warfare first reared its head when man started fighting man.
Developed by nation states.
There could be enough in that bottle to infect every man, woman and child in the world.
Now within reach of those seeking chaos.
You can buy the most toxic substance in the world over the internet.
Man-made, invisible threat on Al Jazeera.
When the news breaks.
The war in Darfur was started with the aims of getting more political representation and economic development.
When people need to be heard.
The top leadership were aware of the potential severity of the virus weeks before the public were told of those dangers.
Al Jazeera has teams on the ground.
The Syrian army seems determined to defeat the rebels and continue its advance towards the city of Idlib.
To bring you more award-winning documentaries and live news.
We understand the differences and similarities of cultures across the world. So no matter what moves you, we'll bring you the news and current affairs that matter to you.
Quick reminder of the top stories here on Al Jazeera. The global number of deaths attributed to the coronavirus is now past 10,000, with just over 4,000 in Italy alone. The World Health Organization has issued a warning to young people, saying a significant number of patients requiring hospitalization are under the age of 50. And the United States and Mexico have agreed to restrict non-essential travel across their shared border to contain the spread of the coronavirus. It follows a similar agreement between the US and Canada. Now, Argentina has adopted one of the strictest measures taken yet by any Latin American country. People will be allowed to leave their homes only for essential needs, such as food shopping or visits to the chemist. Alessandro Rampietti joins us now live from the Colombian capital, Bogota. Just talk us through the steps that Argentina is taking, Alessandro, and how does this compare to the rest of Latin America?
Well, Argentina has entered a full lockdown mode, which was ordered by the president, Alberto Fernandez, who essentially is asking everybody to stay at home, unless, as you were saying in your introduction, they need to find food or medicine. But otherwise, he wants everybody to stay in their houses. And we are already seeing this happening in the streets of Buenos Aires and most of the country. Fernandez said he will be inflexible in enforcing this decision. He said that it's an exceptional measure for exceptional times. Also, all international flights have been banned there, and this is happening in a number of countries across Latin America, Peru, for example, Venezuela, and here in Colombia, where we are, also on Monday, all international flights will end, and even Colombian citizens who are outside of the country will not be able to come back home for at least a month. Where we are here in Bogota, we're living through the first day of a 4-day-long shutdown trial, which was imposed by the mayor here, Claudia Lopez. She wanted to do this because she says that it has never been done before. A city like Bogota is unready to do that, and there is a growing political consensus for a full lockdown here in Colombia as well. Other news that are of much concern here in the region is the fact that the first 2 cases of coronavirus were detected in Haiti, which is the most poor and most densely populated country in Latin America and the Caribbean.
Okay, Alessandro Rampietti, bring us all the very latest there from Bogota. Thank you very much indeed. Now, in other news, 4 men have been hanged in India for the gang rape and murder of a woman 8 years ago. The case made headlines worldwide and provoked nationwide protests. Well, the government since introduced tougher rape laws, but rights groups say the changes haven't actually made India any safer for women. Elizabeth Puranam reports now from New Delhi.
It was the moment many Indians had been waiting for 7 years. And before dawn on Thursday, they counted down the seconds till the 4 convicts were hanged. No one in the country was more relieved than the parents of the victim. Because the law doesn't allow a rape victim to be named, the Indian media calls her Nirbhaya, that means the fearless one.
The crime that was committed against her is always going to cause me grief. But I am proud that if she were alive today, I'd be called a doctor's mother. And today I am proud that I brought her into this world. And now I am known as Nirbhaya's mother. I couldn't save her life, but fought to get her justice.
It's 7 years since Nirbhaya and a male friend were on a bus journey in Delhi. The 23-year-old physiotherapy student was gang-raped by 6 men and her friend beaten before they were thrown out onto the side of a road. Their ordeal led to some of the biggest protests ever seen in India, with widespread demands for justice, not only for Nirbhaya, but better protection for all women. India is consistently ranked as one of the worst countries to be a woman. 6 men were arrested for the attack. One of them was found hanged in jail in 2013. Another, who was 17 at the time of the attack, was released after serving the maximum sentence of 3 years in a reform centre. The 4 remaining convicts were hanged on Thursday morning after they exhausted all of their mercy pleas.
This is not just a day for Nirbhaya, but for all women of this country. It is a day of justice and security.
Since Nirbhaya's attack, the government has introduced tougher laws against rape, such as the death sentence in cases when the victim dies. But rights groups say there is no evidence that the death penalty serves as a deterrent.
As a society and as a country, our gaze is being fixed on the gallows so that we look away from the very many other things which the state should have done to keep women safer and more free, and which the state has absolutely chosen not to do.
The number of reported rapes in India has increased by 34% since 2012. The gang rape and murder of an 8-year-old Kashmiri girl in 2018 and a 26-year-old in Hyderabad last year both led to further nationwide protests.
Women's rights activists say they are fighting a patriarchal system that blames victims. The government, they urge, needs to do more, starting with making public spaces safer for women and reforming the justice system, rather than passing tougher laws, which they say don't work in deterring crimes. Elizabeth Puranam, Al Jazeera, New Delhi.
The Great Barrier Reef is undeniably a natural wonder of the world, but there's also little doubt about the damage climate change is causing. As Alexia Bryan reports from the Whitsunday Islands, there are fears over plans for a huge new coal mine.
In the deep blue Pacific Ocean, off the coast of Queensland, lies a wonderland of coral, fish and picture-perfect beaches. The Great Barrier Reef brings in billions of tourist dollars every year.
Okay, so if you've got your suits, guys, just keep them on, keep your mask, keep your snorkel.
But it's in danger. Scientists and environmentalists say from climate change, caused by the burning of fossil fuels like coal. Tony Fonts has been a dive instructor here for 40 years. He's watched parts of the reef die and fish disappear.
With climate change, global warming, coral bleaching, etc., the reef's health is deteriorating significantly, and that is already affecting the tourism industry.
Despite growing pressure to cut carbon emissions, the Australian government has approved what will be one of the biggest mines owned by the Indian company Adani. Critics say the World Heritage Reef now lies under a coal shipping superhighway, and the Adani project could see many more large ships, bringing coal dust and worsening climate change.
Bleaching is the underwater equivalent of a bushfire. It's caused by extreme climatic events, spikes in temperature, and it's incredibly damaging to the corals.
The government and mining advocates say the mine will bring much-needed jobs and money to the state of Queensland, while Adani argues it's taking steps to protect the environment.
The reef stretches more than 2,000 kilometres up the coast and supports over 60,000 jobs in the region. Many of them are in tourism, and look around me. It's not hard to see why people travel from around the world to get here.
Artist Jessa Lloyd recently unveiled her latest sculpture, which will be sunk in the islands for tourists to snorkel around.
The decision by the government to back the Adani coal mine, it's a murderous one, and it will see the destruction of our beautiful reef.
She says she's been harassed about her opposition to the mine and was told by organisers not to mention it at the event.
And I thought to myself, oh my God, that's a short speech. I'm not going to do that. Not after everything that I've been through. So I thought, just stand your ground, say what you want.
The Whitsunday Regional Council told Al Jazeera in a statement it backs tourism, agriculture and mining, saying it believes they can coexist. Divers like Tony disagree.
But you have to maintain that hope so that you can get up each day and fight for the future health of the reef.
Many here say Australia has tough choices to make about coal, its future, and what sort of country it wants to be. Alexia O'Brien, Al Jazeera, in the Whitsunday Islands, Australia.
Now, social distancing has become a buzzword around the world, but the pandemic message isn't getting through to everyone. That's prompted some medical workers and celebrities to take to social media, as Rahila Mohammed reports.
Distancing from other people is becoming a new way of life for billions worldwide. But not everyone is heeding the advice to help contain the coronavirus, which is adding pressure on hospital staff. These Spanish doctors are worried about too many patients turning up for tests.
When I bring a patient here, I have to go to a special room and change my clothes carefully, then sanitize the ambulance. This whole process takes 3 hours.
See, guys, it takes 3 hours for one patient to be moved around. So please stay at home. If you don't, the health system will collapse.
It's Nurses in many countries from Germany to Malaysia, India to Spain and the United States have come together to send their message, urging everyone to stay indoors even if they don't display symptoms of the virus. That means avoiding restaurants, religious gatherings and large crowds. In other parts of Spain, doctors are optimistic.
On my way to the hospital, roads and shops were empty. Now the emergency room is empty, which means we can attend to patients who need urgent help. This is because of all of us and you. Thank you for making it possible.
I stay home for my husband.
The stay-at-home movement has triggered a widespread response from celebrities and many others, all sharing their reasons for social distancing.
Because the contact that you make with someone who makes contact with someone else, that may be what makes somebody's mom or grandpa or wife sick. Every one of us has someone who is worth staying home for.
My mom is elderly, she's up in her 70s, and I just want to make sure she's safe.
While nations close borders to foreigners, some Canadians and Americans lit up their homes with Christmas lights to bring cheer and hope to their neighbours in isolation. In northeast Italy, glowing colours of the Italian flag were displayed in tribute to everyone forced to stay confined. But as calls continue to grow louder for everyone to take the virus more seriously, the threat of hospitals becoming overwhelmed remains. Rahila Mohammed, Al Jazeera.
Top stories now on Al Jazeera. The global number of deaths attributed to the coronavirus is now past 10,000. Just over 4,000 of those are in Italy, where the record number of deaths in a single day has been broken yet again. The government has just announced an escalation of the lockdown. All public parks will now be closed and people can only exercise in their own homes. The World Health Organization has issued a warning to young people, saying a significant number of patients requiring hospitalization are under the age of 50.
Today, I have a message for young people. You're not invincible. This virus could put you in hospital for weeks or even kill you. Even if you don't get sick, the choices you make about where you go could be the difference between life and death for someone else.
The US and Mexico have agreed to restrict non-essential travel across their shared border to contain the spread of the coronavirus. It follows a similar agreement between the US and Canada. All recreational and tourist travel will be banned, but people will be able to cross for work and the flow of goods won't be affected. For a second day, no new domestic infections have been reported in China. Life has begun to return to normal in some areas, but there are still concerns about cases coming in from overseas. The Chinese government has announced a raft of measures to try and help the economy. And 4 men have been hanged in India for the gang rape and murder of a woman 8 years ago. The case made headlines worldwide and provoked nationwide protests. The government's since introduced tougher rape laws, but rights groups want more changes. Well, those are the headlines. Do stay with us here on Al Jazeera. Inside Story is up next.
Trouble began at the end of the country's civil war when most people started returning home from refugee camps.
Aya Momo, who was shot and killed during a demonstration in 2017, is buried right here in the middle of this street as a sign of resistance to the mining companies and government of Sierra Leone. The standoff over accusations of abuse and displacement between the community, the mining companies and the government has now escalated to West Africa's regional court.
The community has taken its case before West Africa's regional court because they say the people have little faith in the justice system here.
Is total lockdown the cure for the coronavirus? The city at the center of China's crisis reports no new cases for the second day in a row. Should other cities follow Wuhan's lead and imprison millions of its people for weeks? And is China's experiment the model for us all? This is Inside Story. Hello and welcome to the program. I'm Mohammed Jamjoom. The world was stunned when China's government announced the shutdown of Wuhan, the city at the center of the coronavirus outbreak. The blanket quarantine designed to stop the spread of the disease has never been tried on such an enormous scale in modern times. Wuhan in Hubei province is home to 11 million people. They've finally been allowed out of their homes after being stuck there for weeks. Their suffering and the government's gamble seems to have paid off. No new domestic cases were reported for the second successive day. So, should the rest of the world take the same measures? Would they work in Italy, for example, now the epicenter of the pandemic in Europe? Despite no new local cases reported, on Friday, many Chinese are worried by the threat of infected foreigners flying in and importing a second wave of the disease. China's government says precautionary measures will be taken to ensure that doesn't happen.
Communities in all regions must establish the system to prevent and control the import of overseas epidemic and implement the grid management to register, trace and manage the entry passengers with classification. We must conduct full coverage management for the entry passengers and their families.
We'll speak to our guests in a moment, but first let's take a closer look at how China's government has dealt with the outbreak. When the alarm was first raised in December by a doctor, he was arrested and reprimanded. Dr. Li Wenliang later died of the disease and has since become a hero to many Chinese. Eventually, China alerted the World Health Organization about an illness similar to SARS, another health crisis which started in China 18 years ago. By late January, more than 600 Chinese people were infected with coronavirus. A lockdown was imposed on Wuhan and its 11 million citizens. A global emergency was declared at the end of January. By then, 213 people had died in China and almost 10,000 had been infected. The total now is above 81,000. All right, let's bring in our guests in Hong Kong. Professor Nicholas Thomas, who specializes in Asian health security issues at the City University of Hong Kong. In Nottingham, in England, is Steve Tsang. He's director of the China Institute at the School of Oriental and African Studies, University of London. And in Reading, also in the UK, Al Edwards is a professor and immunologist at the University of Reading. Welcome to you all. Nicholas, let me start with you. When China announced it was shutting down Wuhan to prevent further spread of the virus, many were stunned. There was a lot of skepticism. Quarantine on this vast of a scale had never been tried in modern times. Many wondered if it would work. So has China and its approach now been vindicated?
I think China and its approach has been vindicated insofar as it applies to China. I think other countries out there are trialing their own ways of dealing with this and doing it quite successfully. But I think what China showed us is that it overturned what had been a bit of a debate going on within the field as to whether or not quarantines should be used in the first place. And certainly, as you said, on this scale, it was something that hadn't been done before. But I think what the example from China has shown us is that with the correct amount of resources and both the social support combined with the political will, such efforts are possible.
Al, South Korea's approach to COVID-19 has been praised, but it was very different. Singapore and Taiwan were also praised in how they handled combating the virus for their contact tracing efforts. Are Wuhan-style measures necessary to contain the disease?
I think that there are a number of different examples there. Its situation in South Korea, for example, is very interesting because they seem to have been able to be very successful using a testing and tracing based method. But I think it's important to remember that this might be in part due to the sort of pressure they felt a few years ago when they had a big outbreak of the MERS coronavirus. So in some ways, they may be way ahead of the curve, and that may explain their success in their containment strategy.
Steve, from your perspective, do you believe that quarantines of this type will become the new normal?
Well, we are seeing that being much more widely adopted in many different countries, including some of the established democracies in Europe and in North America. But to go back to your earlier questions, I think we should bear in mind that Taiwan, which has not been mentioned, has also adopted a test and trace system, and that works very effectively. We should also bear in mind that when China imposed the lockdown on Wuhan and then Hubei province, it was meant not only to reduce the cases in China, but it was also meant to reduce the spread of the virus beyond the original epicenter of it. And we are now seeing that the virus is practically all over the world. So in the wider objective, the lockdown did not actually work.
Nicholas, I saw you nodding there. Did you want to add to that point?
I think that the case of Taiwan is a very good one. And I think the critical point there is it doesn't matter what the political regime type is, if it's a democracy or if it's authoritarian or somewhere in between. Different states with different scales and capacities can now have a range of measures they can adopt. All of them, however, when you look at Singapore, Taiwan and also South Korea, have a high technology basis and a willingness to use that technology in defense of the society when you do have a coronavirus outbreak. I'm not sure I agree with Steve's point that the quarantine failed. I think rather the failure was on the part of the European and North American countries who looked at China and perhaps were a bit too complacent in the way they approached the virus.
Al, right now China is claiming success, but initially there were many flaws in China's coronavirus strategy, right? And those mistakes really contributed to a surge of transmission, right?
So I think the one thing we shouldn't forget is that what happens when something new arises is that it is just that, it's new. And I think in spite of everyone's preparations all around the world, and in spite of the fact that this kind of outbreak is not unexpected and it's not unknown to science, the precise rate of transmission of this particular virus seems to have been what's caught everybody unprepared. So I think if we look back at mistakes that have been made, what's really clear is that it's the very rapid rate of transfer through populations which is causing so much problems.
Steve, so the threat of coronavirus is diminishing in China, but at the same time, the government has continued to push hard to control what is said about itself. So you've had news being actively censored, citizen journalists have been detained, foreign journalists have been expelled. What else is going on there when it comes to this?
Well, if you look at the composition of the most senior organizations responsible for the virus, the leading small group for countering the virus, which was set up in January, you can see that the one area that the Chinese government wants most people on was not on public health or on the economy, but on propaganda. And that shows you that from the very, very beginning, the Chinese government put higher priority on controlling the narrative of how the Chinese government is dealing with the virus than actually dealing with the virus. And so we can see that once the Chinese governments have found themselves in a situation that they would be able to project themselves in a more positive light than how the rest of the world seem to be dealing with it, particularly the democracies, they have seized that moment and have controlled that narrative and have done so very effectively. And that's basically where we are. And therefore, we are all being directed to focus on how well the Chinese government has been dealing with it. I think we should all be pleased that the virus is more under control in China. We want to see that being under control everywhere in the world. But making that narrative and contrasting it is more for political purposes than for countering the virus.
Nicholas, China the last 2 days is reporting no new local infections. Is the threat now the threat of imported coronavirus infections?
Absolutely. Beijing, as of yesterday, had reported 65 new imported cases. And this is now the worry that China has, in that all the people are now coming, all the Chinese citizens are now coming back, particularly from Europe, transiting other airports around the region to get back into China and get away from the threat that they're now seeing in Europe, and bringing with them a lot more imported cases. But it's not just, obviously, China. Singapore had something like 40 new cases, of which 30 had been imported. Here in Hong Kong, we've seen a spike of roughly 16 new cases, of which I think 14 had travel history to them. So this is the next wave as far as China's concerned. But at least in terms of detection and tracing, because they're scaling down in terms of ongoing community-based transmission across China, they can redirect those resources, and usually fewer resources, towards tracking, tracing, and quarantining people who are bringing in the disease from other countries.
Al, what's the situation currently in Wuhan? Is it still largely under lockdown, or are some of the restrictions starting to be lifted?
So I'm not so familiar with the exact situation on the ground, but I think, to echo some of these previous comments, one of the things that everyone in the world needs to be really focusing on is trying to make sure that they absolutely maximize the resources that are available for things like testing and responding to these outbreaks, because I think that's going to become more and more clear that there's got to be the very best use of the resources that we do have, having established that it's very, very rapidly transmitted, and also secondarily that if there's a sufficient resource deployed correctly, that the number of cases can be kept under control. It's really vital that everybody puts those two things together and makes very best use of the resources they have.
Steve, human rights activists have been making the argument that the fact that China was able to lock down millions of people so swiftly with practically no advance notice, that should not be considered anything other than terrifying. What do you say to that?
Well, I think there is a lot to be said about that, and that is why I underlined the case of Taiwan, where they have used a lot of the tests and track methods, but doing so respecting rights of individuals. And it has worked effectively in Taiwan, a country of something like 22, 23 million people. So it's not a small place like Hong Kong or Singapore. That shows you that even for people of Chinese heritage and Chinese cultural background, different ways of dealing with it can work very effectively, and you don't have to go to the very extreme way how Wuhan and Hubei province were being dealt with in order to contain the virus. I think the really important thing at the moment is that we need to think beyond national boundaries. It is a global pandemic. Until the last country with the virus has managed to contain it, we have not contained it. And therefore, looking at one province, one city having contained it or not really is not a very constructive way to confronting this challenge that we all, as members of the humanity, are facing collectively at this point in our history.
Al, it looked to me like you maybe wanted to jump in. You were nodding along.
I couldn't agree more. I think what we're seeing locally here in the United Kingdom is lots of things happening very, very quickly. But one thing that is really astounding me is the level of change that people are dealing with. So as mentioned, regardless of the political, cultural background, extraordinary changes are needed in individuals' behaviour. I'm not qualified to comment on how that change is achieved. But what I would like to say as a slightly positive note is that in spite of this huge threat and the fact that it is, as mentioned, it's an uncontrolled global pandemic at this stage, certainly what I see locally, and I think this is echoed from news stories we've heard around the world, is that people are rapidly responding to try and ramp up the capability. So when the resources for testing, for example, weren't as widely available, we are jumping and scrambling to increase that resource and make testing more possible on a larger scale. So I expect to see a lot more of this in the coming weeks and months. If you're living somewhere which has not been directly affected yet and you believe that it's something that happens in another country, that's wrong. This is happening everywhere now. And the sooner that people can respond and get measures in place and understand what's going on, the better chance we have of slowing this thing down.
Nicholas, advocacy groups have said that China's draconian measures did indeed slow down the virus, but it also came at a very high cost. So let me ask you your opinion on this. Have human rights become a victim in the battle against coronavirus?
I think that China was faced with a double worst case scenario. I think the Chinese CDC realized that the policy measures being implemented on the ground in Wuhan were going to be insufficient. And at the same time, Chinese New Year was looming, which is the single biggest annual movement of people. Those two factors combined with the increased global connections of Chinese cities to the rest of the world really left the Chinese officials with very little choice. Now, the quarantine measures worked. At the end of the day, they worked. Now, yes, you're talking about an authoritarian country where liberal ideas of democracy are not necessarily going to be present. But at the same time, the overwhelming focus after around the 21st, 22nd of January was in stopping this virus in its tracks, not just for the benefit of the Chinese people, but also to ensure that there was a degree of confidence in the Chinese system internationally. And this is, it has to be said, this is where we're sort of getting to now. The issue that we have going forward is to what extent that model is translatable into other political systems. And there I'm not sure it is, which is why, as I think all three of us have been saying tonight, that the Singapore, Taiwan, South Korean models, with their more advanced use of technology, contact tracing, and so on, perhaps represent a more translatable model and set of protocols for different countries going forward.
Steve, I want to talk for a minute about Dr. Li Wenliang because his death sparked such a massive outpouring of grief in China, and it certainly worried the government because that was happening. So just in the past couple of days, China announced that it has now posthumously exonerated Dr. Li. They have issued a formal apology to his family. They've also apparently doled out disciplinary punishments to 2 police officers for their handling of the matter. How significant is that?
Well, it certainly is a step in the right direction. It would certainly be welcomed generally, but then the reality remains that the 2 police officers who are now being disciplined were doing exactly what their orders were. And what happened to Dr. Lee did not just happen to Dr. Lee, it happens to many others. And the issue there really isn't so much what happens to an individual doctor. The crux of the matter here really was that the party state systematically cover up. We are talking about at least 6 weeks and probably for 2 months when they knew about human-to-human transmissions, and they were being warned about it, and they, instead of doing something about it, cover up and allow that virus to get transmitted, and still are not sharing all the information that will enable all involved anywhere in the world to be able to understand better how the virus originated, and therefore put us in a stronger position to contain the virus and perhaps to prevent something similar from happening again, even if we can contain this wave of the virus. So yes, it's a good thing that they have apologized to Dr. Lee for something that should never have happened in the first instance, but that does not represent a change in policy. It represents a change in public relations management.
Nicholas, let me ask you about Chinese President Xi Jinping. Is he going to be able to leverage this crisis to strengthen his grip on power?
Well, I think actually that question gets back to your previous question about Dr. Lee. I think it shows, I think the state officials' reaction with the posthumous admonition being revoked, I think it shows that the Chinese state itself has become far more greatly sensitized to this issue and to the role of public opinion than they have been for previous outbreaks. And in that sense, I think what we're seeing is an attempt by the Chinese leadership to shore up public support, to acknowledge a significant enough breakdown of trust between the state and society, but at the same time, not a critical one. But instead, they're saying, okay, yes, we made mistakes. I mean, they're actually admitting to this as a way of mitigating the public opinion, the negative public opinion, which is circulating on social media, at least before it gets censored. And they're starting to try to implement this next stage, which sets up China for having successfully overcome the virus, as Steve was mentioning earlier on, and then beginning to shape that narrative into China succeeded here, and we can now be, if you like, a health power role model for other countries going forward.
Al, within China, many provinces shut themselves off to travelers from elsewhere. How much concern is there that the virus will re-emerge once these barriers are lifted and people begin traveling across the country again?
This is the bit that's, the grand challenge for the next, foreseeable future. And I really think nobody has any clear idea how long this is going to take to deal with. Whether it's China or any other country, if you can get, and it's exactly the same for some of these other countries which have responded in different ways but succeeded in controlling things, that you can suppress the fire, but there's still fuel there. So whilst there are people who have not been infected, and whilst there's no vaccine, what's really striking sort of from a biological, virological perspective is quite how quickly this virus spreads, combined with its, really serious mortality rate and sort of toxicity. What that means is that maybe we're going to get stuck in a position where people can either move around or they can be safe, but they can't move around and be safe. So I think that really brings on the next, challenge, which is to make sure that we learn from the systems that are working in terms of tracking and tracing and testing, how quickly and on what scale can we do that kind of tracking and tracing so that we can start to plan for a future where we can reconnect and we can build up global travel and local travel, suppressing this infection. That's going to be really difficult. And we haven't mentioned really yet, but there are many countries in the world which are really going to struggle even more with that, because either the way that their society is set up makes it very hard to do these things, or technologically they may not have the technology and the money and the resources to actually do this kind of testing.
All right, well, we're going to have to leave it there because we've run out of time. Thanks so much to all our guests, Nicholas Thomas, Steve Tsang, and Al Edwards. And thank you, too, for watching. You can see the program again anytime by visiting our website, aljazeera.com. And for further discussion, go to our Facebook page. That's facebook.com/AJ Inside Story. You can also join the conversation on Twitter. Our handle is @AJ Inside Story. From me, Mohammed Jamjoom, and the whole team here, bye for now.
Welcome back. We'll start in Australasia this time. We've seen some very warm air for Sydney over the last 24 to 48 hours. Temperatures way above what we should see this late on in March. But with the winds now coming up from the south, temperatures pegged back at about 24 degrees for Saturday there. We've got a frontal system working its way across New Zealand, certainly in the South Island, some heavy rain during the course of Saturday. And then as we head on into Sunday, that system working further northwards into the North Island. Brighter weather further to the south. Weather system clearing through Tasmania. Out across Western Australia, we've got generally fine conditions for Perth there and temperatures into the low 30s. Northwards into northeastern parts of Asia, we've lost one weather system out into the North Pacific. Brighter conditions following on behind. Indeed, quite warm conditions for Tokyo. Definitely spring-like here at the moment, but still the chance of some showers on the western side of Honshu. It should be largely fine across the Korean Peninsula, 1 or 2 showers. Some heavy rain you'll notice across more southern parts of China. Heading on through into Sunday, that moves out across the East China Sea into southern parts of Japan. So the weather gradually deteriorating during the course of the day on Sunday. Should be bright by that stage across South Korea with a high of 15 degrees expected in Seoul.
Singapore is being accused of expanding its coastline with illegally dredged sand.
Some of the islands off the coast of Indonesia literally vanished.
It's a big business, smuggling sand.
When they go take this sand, they're in killing.
The sand is our barricade.
You see this beautiful beach, but behind it is something that's not so pleasant.
The tragedy is that people are just not aware.
An ecological investigation into a global emergency. Sand wars at this time on Al Jazeera.
This is Al Jazeera.
Hello there, I'm Hala Mahideen, and this is the Al Jazeera News Hour, live from London. Coming up, 10,000 deaths globally from the coronavirus. The WHO warns a significant number of those needing hospital care are under the age of 50.
I have a message for young people. You're not invincible. This virus could put you in hospital for weeks or even kill you.
Britain's government orders cafes, bars and restaurants to close as it toughens its response to COVID-19. As the US state of California rolls out major restrictions on its 40 million residents, non-essential workers in New York are ordered to stay home. And fighting the brave fight, concerns for the physical and mental health of medical workers on the front line of the pandemic. Well, the coronavirus pandemic has hit another grim milestone as the global number of deaths attributed to the disease passes 10,000. Just over 4,000 of those are in Italy, where the record number for the total fatalities in a single day has been broken yet again. Soldiers are now being deployed in the hard-hit Lombardy region to enforce restrictions. Now, in the US, the governor of New York State says 100% of non-essential workers must stay at home. That came a day after the announcement of a lockdown in California. While in Britain, 65,000 retired doctors and nurses have been asked to return to work as the Prime Minister doubled down on national restrictions, ordering bars, restaurants and gyms to close in a matter of hours. And in a stark warning to younger people, the head of the World Health Organization revealed that people under 50 make up a significant number of those needing hospital care. Well, Paul Brennan has more on the situation across Europe.
Across Europe, coronavirus lockdowns have largely emptied the streets to reduce the chances of person-to-person infection. In Paris, residents face a $150 fine if caught outside without good reason. Exercise is permitted, even encouraged, but new restrictions have been imposed along the River Seine and around the Eiffel Tower.
We are at the start of this crisis, as I have reminded the French people in the beginning of this week. We put in place measures to absorb this first wave. It's a race against the virus.
Despite nearly 2 weeks in lockdown, Italy has seen the numbers dead and infected hitting record new highs. People are only allowed out for work, medical reasons or emergencies, and those allowances are expected to be made even tighter this weekend.
This is just a snapshot of life in central London, but compared to the lockdowns in France and Italy, the difference is striking. Shops are still open, people are still walking around, driving around. Each and every contact, an opportunity for the virus to spread.
I have a message for young people. You're not invincible. Even if you don't get sick, the choices you make about where you go could be the difference between life and death for someone else.
Until now, restrictions in the UK have been advisory rather than compulsory. But an order for schools to shut finally has come into effect, and the gates will not reopen on Monday. At his latest daily coronavirus briefing, the Prime Minister's guidance to leisure venues became a closure order.
We are collectively telling cafes, pubs, bars and restaurants to close tonight as soon as they reasonably can, and not to open tomorrow.
Newly published documents hint at the struggle ahead. The UK government's latest scientific advice makes sobering reading. SAGE has warned the government that a combination of case isolation, household isolation and social distancing of vulnerable groups is very unlikely to prevent critical care facilities being overwhelmed. Adding general social distancing and school closures to the mix would probably work if kept in place for a long period. How long? The government has been warned that to be effective, a policy of alternating between more and less strict measures would need to be in place for at least most of a year. Around the world, governments are enacting emergency powers, imposing draconian restrictions and confining whole populations in their homes. And there is no imminent exit strategy. Paul Brennan, Al Jazeera.
As we've been hearing there in the UK, the Prime Minister has, of course, announced new measures to combat the virus. Let's get more now from Niamh Barker. He joins me now on set. Niamh, lots to talk about, but let's start in Italy, of course. The death toll there has soared yet again, and now stricter measures are coming into force in Italy as well.
Yes, well, the last time the official number was given, it was 627. It may have gone up in the last hour or so. We haven't yet got clarification. But just to put that into perspective, that's the biggest single-day jump in the death toll of any country since the beginning of the coronavirus outbreak in China several months ago. The average death toll in Wuhan province at the height of its crisis was 150 deaths a day. In Italy, over the past few days, we've been seeing an average of around 450 deaths, so 627, an alarming number. What the Italian government are hoping to do is ramp up restrictions. We know that parks are now closed, restricting, of course, places where people can gather in any large number. But despite a lockdown nationwide, encompassing all 60 million or so people in the past few days have still been able to go out to work. And the message from Chinese advisors, the Red Cross, is that, look, you need to economically lock down the entire country if these measures are going to be effective. We've seen the military being drafted in Lombardy, where the principal city is Milan, the financial centre. It looks like we may see a more intense military presence nationwide as the Italians really try to bring this critical situation under control.
Let's turn our focus to the UK now. There's still no lockdown here at all, but the Prime Minister has been announcing more restrictions on daily life.
Yes, Boris Johnson announced that there is now an order for all bars, restaurants, cafes, theatres to close as of this evening. They'll be closed indefinitely, and that situation will be reviewed on a month-by-month basis. Obviously, that's a big blow to these businesses who've been essentially holding out to the last minute. But I think a lot of people have been questioning why the British government hadn't enforced this ruling. Now they believe it is time to do it. They've been ramping up restrictions incrementally. Also, a critical development in London in the last few hours, an intensive care unit in a hospital in Harrow in northwest London announcing that they are overwhelmed with coronavirus cases, 6 deaths there. Obviously, alarming developments. What we thought was going to be a coronavirus peak in several weeks' time looks to be happening much earlier than expected. Britain's National Health Service told to be prepared and be ready to provide an extra 30,000 beds as soon as possible.
OK, a very troubling situation indeed. And Niamh Barker, for now, thank you very much indeed. Well, let's get more on this now and speak to Sterios Moschos. He's an associate professor in cellular and molecular sciences at Northumbria University and joins us on Skype. Good to have you with us here on the News Hour. Now, we have been hearing criticism of the UK government's gradual approach. Do you think that criticism is warranted?
Well, it's a difficult call, really. If it was my choice, I would have put us all into lockdown and implemented mass screening more than a week ago. However, one has to take also the economy into account, and I wouldn't be surprised if several months down the line we are told that this was a ramping up process to try and hammer home the message of this is serious, but also to allow people the time to prepare for a situation where we will all be in social distancing and in lockdown for an extended period.
But the UK government's been insisting they've been following the science. It sounds like there could have been other factors in play, trying to prepare people in a behavioural science way, or perhaps trying to safeguard the economy. I mean, what's really driving government's actions? Why do you think we're seeing so many disparate approaches worldwide?
I think you need to ask each government about what drives their specific actions, and they will probably tell you the science advice that we're getting. If you look at the SAGE report that came out today as to how the advice was given to the government, the fact that committees largely structured around flu pandemics, about behavioural science, actually shows where the information was sourced and what kind of approach was taken to this. They were basically translating what we know about flu onto coronavirus, and I'm not the first one to say this, coronavirus is not flu. And that has been one of the major drivers. And on top of that, we have to bear in mind that this is a very complicated society, very complicated supply chains for everything from food to electronics. And you can't just shutter straight away. There needs to be some kind of preparation. The extent of preparation that is necessary, I'm not the person to judge that. So I'm hoping that the decisions that have been taken with a more rounded view as to what needs to be factored into such decisions.
Well, let's broaden our scope somewhat. Talk to me about Italy. We're seeing tragic numbers coming out of there. I mean, it appears that, this virus originated in China, but it's killing far more Italians than any other nationality. Why? Why is this?
It's a very difficult question. I think a coincidence of bad luck and lack of preparedness in Italy probably is to blame. So we had the skiing season, if you like, in Italy that attracts people in the Alps worldwide. This is Lombardy, the region that is most affected from Italy. The Italians have admitted themselves that they had patients coming in with symptoms and they were just not recognizing them in the first few days. And as we know now, there's a 2 to 3 week window between which the cases start showing and then poof, it takes over. And by the time they recognized what was happening, doctors were already infected with the virus, and there was a flood of people coming or waiting to come onto the system. On top of that, Italy has I think it's the second most aged population in the world. And we know already that this virus hits preferably the elder members of our society. So a combination of these two things seems to have really toppled over the Pisa Tower, so to speak.
It certainly does. Well, I mean, do you think, we're still learning about this virus, we're still learning about how it's affecting different populations worldwide. Yeah. Do you think we're going to see other Italys? Are we going to see other examples of 39-year-olds in intensive care, the death toll, the average death toll being over 400, 500, 600 per day?
I don't think it's important to emphasize on the numbers per day right now. I think it's more, the fact that some young people will end up in ICU. There will be young people, there will be children that will go into ICU. That has been documented in China. It will happen. But in the population level, we're talking about a very small fraction of your population that will end up dying because of this disease. And that's, of course, provided that we can contain the flood of people going into the intensive care units. We've already had one 24-hour red alert period, if you like, in Northwick Park. Let's just hope that this is not as bad going forward in the next week and the week after. But I can't put my hand in fire and say this is going to be brutal. The signs are there that things are going to get nasty for the next couple of weeks, but let's hope it won't be.
Indeed, let's hope it won't. Stelios Moschos, thank you so much for joining us there from Northumbria University. The key message there is containment as much as possible and, of course, wash your hands. As the sobering statistics continue to roll in, the US and Mexico have now agreed to restrict non-essential travel across their shared border to contain the spread of the coronavirus. Now, this follows a similar agreement between the US and Canada, which is now in effect. All recreational and tourist travel will be barred, but people will be able to cross for work and the flow of goods won't be affected. President Donald Trump says he will also invoke a health-focused law to block migrants from coming in. Well, California and New York have also moved to restrict the movements of people. Heidi Jo Castro joins us now live from Washington, D.C. With more now. Heidi, we're hearing that the state of Illinois has also followed suit. It really appears to be state governors who are leading the fight against coronavirus at this stage.
That's right, in taking definitive leadership actions, that does appear to be the case. As you said, Illinois now is the third state to issue these drastic orders to all of its residents. This was just announced about an hour ago, for everyone to shelter in place starting tomorrow until April 7th. Now, President Trump was asked to address these measures earlier in the day during his coronavirus briefing. Now, with 14,000 Americans who are infected and more than 200 dead, he was asked to talk directly to Americans who are seeing this happen and are scared. But rather than answer the question, he attacked the reporter, calling that a nasty question and accusing the reporter of sensationalizing the story. Now, even as this was happening, President Trump also dug into his much panned comments from yesterday, claiming that an anti-malarial drug is effective in treating the coronavirus, again calling this medicine a game changer. He said that even though now a second top U.S. scientist has contradicted that claim, saying that there was no clinical evidence that this drug was effective, that it was all anecdotal. President Trump then clarifying his statement, saying that he simply had a good feeling about this drug. Now, of course, this is the same president who just 2.5 weeks ago said that he thought this coronavirus may just disappear, quote, like a miracle. Hala.
Well, Heidi, aside from the briefing from President Trump, we did also have a briefing from the Pentagon, and that's about Army Corps engineers working with the state governments. Just tell us more about that.
That's right. This is a pretty dramatic ramping up of the military response to coronavirus in the U.S., with the Army Corps of Engineers announcing that by the end of today, it will be working with 18 state governments to increase hospital bed space and the medical response to this pandemic. Now, not only is the military ramping up its response, but also private industry. There are reports that cruise liners have offered to use their cruise ships docked at American ports to be floating quarantine units or hospitals if warranted. And also private industry manufacturers have now been allowed to sell industry-grade respirator masks to hospital workers if needed, which frees up potentially millions more of those masks in the face of shortages that we've seen across the country.
OK, Heidi Jo Castro, bring us all the very latest there from Washington, D.C. Thank you very much indeed. Now, Iran's supreme leader, Ayatollah Ali Khamenei, says the country will overcome the coronavirus pandemic and the economic fallout. In a televised speech for the Persian New Year, Iran's highest authorities said it was a tumultuous year for Iranians suffering under US sanctions. He called for the restrictions to be lifted so the country can receive much-needed medical supplies. Nearly 20,000 people in Iran have been infected and more than 1,400 have died. Zain Basravi is in Tehran, where those sanctions are biting.
It's been a difficult one for Iranians so far. They acknowledged that the coronavirus had been a very terrible challenge and defended the country's response, despite the fact that many have been critical against the government for not taking this seriously enough, soon enough. But really, what many people will have been watching for is what they had to say about American sanctions. Now, on the eve of the Persian New Year, the United States placed more sanctions on Iran, more Iran-related sanctions, this time sanctioning 5 entities based out of the UAE, accusing them of facilitating Iranian oil sales. Now, on Tuesday, just a few days earlier, they placed sanctions on a handful of Iranian nuclear scientists, as well as entities based in Pakistan, Russia, China, and the UAE, signaling that